property owner.
We can get that. We can get that information.
Okay.
Jeff, we'll get all that warranty information, please.
All right.
Anything else?
Thank you.
Thank you.
Thank you.
Health and Human Service, Mr. David Howard.
Good evening.
Consider approving a fee and eligibility policy revision.
All these policies have come to you with recommendation for approval from the Health and Human Services Advisory Committee, so you know. The first one, you'll notice in your packet, we highlighted the edits for you. So a few pages in, we added some language mostly for clarification of what we do when patients request confidentiality, not able to bill or send them mail or those kinds of things. And then also we had to make it clear as to the percentage of the federal poverty level, which triggers us to actually bill them for self-pay patients. So if they don't have insurance or Medicaid, then that's what we do with them.
Motion by Mr. Trivett, second by Mr. Goodman. Any discussion?
Are these fees still in line with ones that were previous from last year?
Excuse me?
Are they still in line with what was the fees and eligibility of those things last year?
Yeah, so the fees really aren't changing. It's just an added language to clarify how we handle people
Kind of question.
at that level.
Mr. Chair, what are the fees? Give me just for one particular thing on two things. Are the fees based on whether you are prenatal care or versus something else?
Fees are based in a general sense. I can't quote any to you, unfortunately. That's memorized. They're based on our cost. So, but we base our fees the same as any other practice would.
Really?
But what we get paid is the same as what they get paid. So if we're reimbursed at the Medicaid rate, that's what we get paid, the same as any other practice. If someone comes in and they qualify on a sliding fee scale, which we have, to zero, then they get charged zero. If they're above, as in this policy, above 250% of the federal poverty level for their family size, they're charged the fee that applies to that service.
Do you have trouble collecting?
Usually, yes, but we pursue them with reasonable vigor, but we don't have any problem collecting from Medicaid or insurance, really.
I mean, self-pay.
On private pay patients, we really don't have a lot of those. They usually are coming in and they're low income and they qualify for zero or very reduced fees.
Motion by Mr. Trivett, second by Mr. Goodman. Any discussion? Mr. Bullock?
Once Medicaid considered the bill, then it's paid in full then, is that right?
That's correct.
Okay, thank you.
Yeah, we don't circle back around.
Any more questions? All in favor say aye.
Aye.
All opposed? Consider approving internal control policy revision.
And this is, the only addition there is just to clarify the time study procedure.
Motion by Mr. Trivett, second by
Second.
Dr. Alfield going. Any discussion?
One question, Ms. B, is I want to make sure, is this the one that, remember we got into the discussion with the auditor, is this internal audit, is this in line with what he recommended to us, where we had some questions about last time? Does this fall in line with that procedure that he put in place, or this one we put in place for that?
So right, the way we get paid from the state is using these time studies. So each employee who has billable time for the state money that we get for the different programs, in addition to their time sheet, they record a time study in which details the time they spend in each program. And those hours go into our cost report, which is our evidence of what we pull down from the state as far as the money. We pull that money down in arrears. So the people work in a program for 10 hours in August, we pull the money in September for 10 hours of time for that program. Until it's gone, we usually pull it all down.
This covers money that's being collected, like when we collect it throughout the agency, this is that policy we put in place.
Right, the time study only applies to the money that we receive through the state, whether it's federal money or state money, regardless.
That's based off of you having to turn in those reports, those forms. It's like you're getting paid in arrears, that you've got to turn in to get paid.
Right.
You know, I was reading the cash receipt portion of it, so that's the same thing.
Mr. Chairman, I think Mr. Cogdill is referring to the segregation of duties policy related to internal controls. If I'm not mistaken, I think it's a separate.
Remember we came into the big question about that last time with the auditor and gotten all this controversy.
This is separate.
This is separate?
Yes, sir.
Okay. It's the same idea, but we have enough people to take care of that in the health department.
Okay.
Greg can share that with you later, Greg.
Okay. I'm not sure.
All in favor say aye.
Aye.
All opposed? Item C is consider approving an Office of Rural Health Grant application for the benefit of women and children's services.
Make a motion
Make a
to approve.
motion.
All right, I'll feel I'm going, made a motion, second by Ms. Trivett. Any discussion?
Question. Does this, do we have to do any matching funds with this grant or just straight out grant? All right.
You got anything you want to say, Ed?
The funding is to replace money that we've lost from the maternal and child health block grant.
Okay.
That comes from the feds to, or part of the Title V block grant to the state. More money has been carved out by the legislature to other programs, not profits, it's a health department. So rural health stepped up to fill some of the gap.
Okay.
Thank you, sir.
Any other questions? All in favor, say aye.
Aye.
All opposed? Item D is update regarding an opium forum scheduled for Tuesday, September 12th.
All right, so I provided a two-page quick update for you all on the opioid forum. As it mentions, this is initiated by the North Carolina Association of County Commissioners along with the National Association of Counties. As Mr. Peterson mentioned, the forum is scheduled for September 12th on Tuesday out at Community College from 2 to 5 p.m. I gave you an invitees list on the bottom of that page 1. Additional suggestions are certainly welcome. But what this is designed to do is sort of allow the elected officials, commissioners, take a lead role on addressing the issue county by county by county. The real goal of the meeting is to get some idea generation and some good robust discussion going among community leaders about the problem, how it manifests itself in Bladen County as opposed to a Sanderson or New Hanover or Cumberland County, because it's a little bit different in each county. We had some good comments and discussion, which I highlighted for you on page 2. From a planning meeting we did, we got some good comments from law enforcement about what they're seeing, because, for instance, they mentioned they're seeing a lot more prescription medications around the county as opposed to illicit heroin, et cetera. Now, there's some of that, but that might be a good sign that we can nip that in the bud. But the goal of the forum mostly is to generate discussion, and it's a beginning point, really. Usually some committees, task forces grow out of that, and we continue the effort across the community. We come up with some ideas as far as how we're going to attack it in Bladen that is more specific to the problems we're having here.
Mr. Caldwell?
On this forum, this is open to the public, so if anyone wants to attend it, just close in.
Well, it's not really designed to be open to the public as far as contribution. It's designed for elected officials, other people from the community. It might grow to 50, 60 people, but it's not necessarily designed for the public input at that meeting. We can choose, we all can choose to make it open for observation and listening to the public, but it's really designed so the meat of the meeting is going to be small groups having discussion. So it's more like a planning meeting, a strategic planning meeting, if you will, if you've ever done one of those. So people are going to be in small groups around tables doing discussion a lot of the time, bringing those out to the larger group, and I'm going to be recording those and moderating those and coming to some idea generation. So it's not really a presentation for public consumption, if you will.
Mr. Chairman.
Hold on, Mr. Pruitt.
Mr. Howard, I have a question. I had a senior to approach me in their 80s, and normally when they have to go to a hospital and then transfer to a nursing center, family members got to go, then normally they're upset, it's a tough time, and this, that, and the other. But, and when they apply and get help from Medicaid, and they have Medicare, and it was brought to my attention that it was told that they had to notify Medicaid or the county that their loved one had gone home because they would continue to be billed for several days, and the county pursued billing the individual instead of billing the nursing home that received the funds. My question there would be to this family is that how and why would the nursing home bill for a patient that is not there any longer, and then the county pay for it, or Medicaid pay for it? But why would they expect the individual that's, when they're needing the assistance, obviously they're a lot poorer than Medicaid is, and they're looking at the senior to reimburse the money that the nursing home received and threatened by that?
Well, without seeing the specifics of that, it's hard to comment, but normally, the only reason they should bill is if they have additional expenses on for days beyond what Medicaid is gonna pay or what Medicare is gonna pay. Of course, they always limit their days for what they're gonna pay, depending on the incident and what the doctor says they need. But if they're billing for funds for services that have already been paid by Medicaid, I don't know if they're allowed to bill over and beyond what they incurred as far as costs beyond Medicaid, which sort of relates to Mr. Bullock's question. Are you going back to the difference kind of thing?
In this case, because I saw it, I wouldn't think they could bill them if they were not there. Look, to me, that would be fraudulent billing for a patient that's already gone home. And why would you expect
Right.
an 86-year-old to say, hey, they went home?
So they're billing for 6 days and they were only there 3 days kind of
Right.
thing? Sorry, for me to answer that, to be honest.
Give them a name and follow up.
Getting back to,
Hold on a minute, please. Mr. Bullock?
Mr. Howard, another question I have, we have this form coming up on open door. Is it possible we could get some other type of form for the crack cocaine and other illegal drugs as well? Because that seems to be a problem in our county as well.
Yeah, and that's a good question because, the opioid crisis follows the crack crisis, follows the cocaine crisis, follows the pot crisis, go back 50 years. So we can have that discussion at the forum as far as how all the substances work together. So if you have some things that are gateway to heroin, we can discuss that as a larger issue.
I think it'd be a good idea.
This initiative comes from the North Carolina County Commissioner Association, and opium is what they chose. Mr. Cogdell?
the question I got, when I read through your notes here, the planning meeting here, and who was in attendance. And the reason I asked was it gonna be open, I thought that it would be, are we gonna get to a point where it's gonna be more community involvement with this?
Oh, yeah.
Then this is just something to initial phase, but this is not where we're gonna start going in and start outlining objectives and how we doing this. Because what I'm saying is,
No, we're
I
trying to
want
get
to know is community organization gonna be a part of it? Is how is this gonna be with addressing the concerns, like you clergy and communities and?
Right.
They are part of it.
Yeah, they're invited.
If someone comes to BCC and wants to attend this meeting, they're not gonna be turned away. They can come in.
I mean, that's what that.
We're not turning no one
That's what I
away.
wanted to clarify. It's elected officials will be present, so it's technically a public meeting.
That's what I'm
and-
saying.
And it's
Yeah,
in the
we're not
auditorium,
turning
so there'll be
anyone
plenty
away.
of seating and,
Yeah.
That's
sure
what
with
they
the
were
advertising-
in this case, it did fill up.
Okay, that was the reason I asked. I wanted to make sure, like, if I want to invite some clergy or some community organization
We're not
people,
gonna turn anybody
who
away.
you invite them to come in to be a part of this meeting that's gonna be going, so they be aware. That's why I want to know what's gonna be a part
Yeah,
of the meeting.
we're gonna have plenty of rooms.
Okay, I wanna
My
make sure.
question is, how many commissioners can attend?
All of them.
All of
We
it.
can't, not an issue.
No.
Okay, thank
I'm
you.
just
Yes,
saying.
at the same table.
So, that was my reason. If all
Yeah,
of
it's a
us gonna be
public-
there,
it's
it's
a
a
public
public
meeting.
meeting, there, anybody should be able to
Well,
walk in.
that's what I was telling you. We're not gonna turn anybody
Okay,
away.
so it's a public
Make
meeting,
sure.
that's all it is.
But there's a targeted audience that's being invited.
Okay, I understand that too.
But if anybody wants to go, they're welcome to come. I would ask one thing, if we do a test run on this before September the 12th, and get everybody that's gonna be participating or presenting, and let's do a test run, that's my request. Any other questions?
Yeah, that was it, I just wanna make sure.
No, we're not gonna turn anybody away.
Okay.
Okay, thank you, sir.
Thank you.
Advisory appointees, EMS Council, we got a letter from Mr. David, so Mr. Britt's going on.
Lisa Bird's term expired 10/31/27, no longer with Cape Fear Valley, recommended replacement with Dr. Roxy Wells.
Let's move on.
Dr. Greg Lucy expires 10/31/2017, no longer living in the state, recommended replacement with Tiffany Pate from Cape Fear Valley due to being clinical educator. Sheriff Prentice Benson, communication representative, expires 10/31/2017, recommended replaced with Jeff Singletary or Sheriff McVicker. Gene Lockamy, firefighter, expires 10/31/2017, replaced with representative of Health Department due to working relations for community health, recommend Deborah Connor.
I'd like to, I guess, ask Jeff.
No, we need to appoint the sheriff, and if the sheriff can't go, he have a appointee.
Yeah.
I think the appointee is for the sheriff.
Well, this is,
This is the EMS board. Mr. Brett made a motion to approve. Second, Mr. Good. Any discussion? That comes straight from the EMS director. Okay, all in favor say aye.
Aye.
All opposed? Item B, Industrial Facility and Pollution Control Finance Authority. Anybody got anybody? Motion table.
What do they do?
That, motion by Ms. Tripp, second by Dr. Freeman, going to the table. Any discussion? All in favor say aye.
Aye.
All opposed? And entertain a motion to table the planning board too.
So moved.
Dr. Freeman, Dawn made the motion, second by Mr. Cogdale. Any discussion? All in favor say aye.
Aye.
So let's be prepared to do B, C, and do Keep Bladen Beautiful, and the Volunteer Ag District will be at our next meeting. No, that's September 18th. Let's just try to do the industrial facility and the ones we tabled tonight at our next meeting, and then we got the other two for the middle of the month. Okay? So, and that planning board, there's 9 people on that planning board, and each commissioner has a person assigned to them, and I think this assignee that's resigned is Mr. Brett.
Oh, okay.
So he needs to bring one. And we, maybe Marie can send everybody a copy of who your representative
Yeah,
is.
be good. Be good.
Thank
She
you.
can do that for us. And, counter up, Mr. Martin, counter update.
Thank you, Mr. Chairman. I'd like to review the calendar for the remainder of the month of August and as well as September. And just point out to you that this Wednesday, the 23rd at 8:30 a.m., the Bladen County Schools will have its opening day convocation ceremony at the Elizabethtown Middle School. And you all are invited to attend that. On Thursday, the 24th, from 6 until 9 p.m., the Summer Sounds Concert Series will have its last event for the year, and that will be at the Elizabethtown, in Elizabethtown at the Farmers Market. On Thursday, the 31st, at 1:30 p.m., Congressman Robert Pittenger's town hall meeting will take place at the Cape Fear Farmers Market. You're invited to that. Moving over to September, offices are closed on Monday the 4th in observance of the Labor Day holiday. On Tuesday the 5th at 8 a.m. there's a prayer service here. That evening the board meets at 6:30. On Friday the 8th at 10 a.m. the Bladen County Detention and Law Enforcement Center open house will be held at the facility there on Smith Circle. On Saturday the 9th, from 7 a.m. until 6 p.m., the Mountains to the Sea Trail event will take place throughout the state, and I'll speak to that more in just a moment. Also that day at 4 p.m., the East Arcadia Senior Center annual banquet will be held. On Monday the 11th at 6 p.m., the Crowd America event will take place on the courthouse lawn. On Tuesday the 12th from 2 until 5, the Bladen County Leadership Forum on Opioid Abuse will be held at the Bladen Community College Auditorium. On Thursday the 14th at 7 p.m., the Bladen County Fire Association meeting will be held at the Lisbon Fire Department. On Saturday the 16th at 10 a.m., the Dublin Peanut Festival will be held at the elementary school there in Dublin. And then on Monday the 18th at 6:30, the Board of Commissioners meets here.
Greg, on September the 9th, the 100-year celebration of the Historical Society at Middle School in Bladenboro.
Okay,
It's
thank you.
happening at 10 o'clock on the 9th.
Thank you.
Yeah, and the ones that go, they got a nice gift for the people that go.
Very good.
Okay, thank you. Add that.
What time?
10 o'clock.
For
Okay, Mr. Martin, any other thing on the calendar? Okay, Mr. Martin.
item B, this is something to add to the, potentially add to the calendar, is to consider a date for the Board of Health training. We know we had talked about a date at the last meeting and that didn't work. So 3 dates that are proposed include Monday, September 11th, Monday, September 25th, and Tuesday, September 26th. And the thought particularly on the 11th is like a 4 p.m. start time. I know
Yeah,
we
it's
have
gonna be
been
here at
at
6
6.
o'clock, so maybe we can do it at 4
You love it?
Which one is that now?
on September the
Board of
11th.
Health training.
What time is supposed to come, what time?
Well, Crown America's at 6 o'clock, we come at 4 o'clock, we knock both of them out.
That's the only one I can make. That's the only one I can make.
That good for everybody?
That's on Wednesday, is that now?
Monday,
Only one I
4
can
o'clock.
Monday, 11.
Crowd is at 6.
It's okay.
That's at 4.
Okay, can we entertain a motion to do, September the 11th at 4
I'll
o'clock?
make a motion.
Motion by Mr. Britt, second by Mr. Cogdale. Any discussion, all in favor say aye. September 11th, 4 o'clock.
Schedule of the board. Yeah.
Thank you very much.
Anything else, Mr.
And
Martin?
yes, sir, just one last thing, I'd like to,
You know,
I mentioned in the calendar, but just to reiterate, the Mountains to the Sea Trail is celebrating its 40th anniversary from its announced inception. And they are hoping to hike the entire length of the trail in one day on September 9th. And that's 1,175 miles total, 39 miles of which is in Bladen County. And so Mr. Mr. Carl DeAndre is helping to promote this event here in the county, and his email address and telephone number is, I know that's going to be advertised largely before then, but he's trying to schedule times and individuals to walk certain sections of the 39-mile portion of the trail in Bladen County. So we just want to help promote that, and any of you who are interested or have friends who are, please encourage them to participate.
Can you just contact him and see if there's any, whatever we can do to help, let us know?
Yeah, I'll be glad.
Okay.
I understand one question. The repurposing of the church field.
That's still in the planning session. That's still in the very early planning stages.
So we have.
But I'll be glad to. There hasn't really been any, other than preliminary design type work, there hasn't been any real
So, but you
concrete plans.
We working on putting.
Yes, sir. Skip McCleary's working on that.
Okay, item 14 is closed session, considering the closed session according to the NCGB 43-3-11A as free attorney-client privilege and NCGB 43-3-18.11A. Six personnel, motion by Ms. Tritt, second by Mr. Bullock, any discussion? All in favor, say aye. Aye. Let's take about 5 minutes.
I get your phone, I can't go downstairs, so you can keep saying.